Hello everyone and welcome to Module 6. This week our topic is going to be assisting with the physical examination and learning how to do chart documentations. So it's going to build a little bit on what we've already been doing, but adding those extra pieces in on what's really going to be important for you as the medical assistant. So as we get into this, the first thing that we're going to be looking at is what does it mean to be assisting with a physical examination? So one of the key responsibilities of the medical assistant is to help out during a physical examination. Specifically that when we have like a female patient and a male provider, we end up helping out a little bit more during those. But our role during this also includes preparing the examination room, interviewing the patient, documenting all of the information in the medical record, positioning and draping the patient, assisting the physician during the physical examination, cleaning the room after the visit, and then taking care of the instruments. So one of the things I want to do is go through each of those individual pieces and talk a little bit more about them, just so you guys have a better idea of what would be your responsibility as the medical assistant. So the first thing we're going to talk about is how you help to prepare the examination room. So this will require you as the medical assistant to dispose of the used patient gowns and drapes. So if something happened or there was another visit prior to, you would want to make sure that you clean that room first before you bring in your next patient. When I say clean the room, that does include cleaning the examination table with the proper disinfectant and replacing the table paper. Most places now are using something called a cavi wipe, but if your site does not use that, you could also use a 10-to-1 bleach solution. So either one of those would be perfectly acceptable, and then you would want to again make sure that the table paper is changed out. Even if the patient didn't use it, you don't know what bacteria or what, any sort of ickiness might be left on the table. So the best thing to do there is to go ahead and just clean the table and remove the table paper and get new table paper. You want to dispose of any equipment that was used during the previous examination. If it was reusable, you want to make sure that you put it into a container to be disinfected appropriately. If it was something like a needle or a sharp, you would want to make sure that that goes into a sharps container. You also want to disinfect all of the surfaces in the room. So not just the exam table, but where the patient sat, if there's an extra chair, door handles, computer equipment, so keyboards, mouses, anything like that that could be a potential site or could hold bacterial information. You want to go ahead and make sure you clean that up for the next patient. Especially if, during COVID times, people can be asymptomatic and not know that they have the virus. So we want to make sure we just clean those places appropriately. And then make sure that any lids on biohazardous containers are closed. And if the container is full, you go ahead and remove it and replace it. Remember that all biohazard containers are considered full when they are 3/4 of the way full. Next, we have interviewing the patient. And this is where we actually take the patient's health history. And the health history is really broken down into 6 categories: the chief complaint, the present illness, the past medical history, the family medical history, social history, and the review of systems. And so let's talk about kind of what each one of those really means and what your role is with that. Now, the document that I have on the screen right now is actually what we used to use a million years ago when we did paper charting. But we have something very similar to this in the electronic health record now. But instead of having like sort of click buttons that you could, just check off what the patient has, it would be you typing those symptoms in. So the chief complaint is the main reason for the patient's visit. So it tells us why they're there. Okay. With that, You want to get, pretty descriptive, but also kind of keep it short and sweet. You can do more documentation when you talk about the present illness. So the present illness and the chief complaint can kind of, again, go hand in hand, but the present illness will contain detailed descriptions of the symptoms that the patient has. Things like, when did it start? How long has it been lasting? What's the intensity of each symptom? So that pain scale that we have of 1 to 10, 10 being the worst. And then we also ask some other sort of questions to lead into this. If they're saying that they're having pain, we want to ask things like, have you had an injury? If they say that they've been feeling sick, any exposure to anybody. If somebody comes in complaining of itchy red eyes that are draining, we want to ask things like, have you been around anybody who's had pink eye? So it's really not just about, the who, what, when, where, and why. It's asking those other leading questions to get as much information as we can for the providers. The past medical history kind of makes sense. It's the part of the history that includes any and all diseases or medical problems that the patient has experienced in their past. So that's prior to that day's visit. That would include any former surgeries that they've had, any treatments that they're being, seeking, any other conditions that we should know about. Family medical history is a record of the patient's blood relations health problems. So that could be specifically looking at mom and dad, brothers and sisters, grandma and grandpa that are blood related, and aunts and uncles that are blood related. So, for example, let's say that your uncle has diabetes and he is your mother's brother. Well, that's important for us to know because that's a family history. But if his wife has cancer, that's not going to affect you because unless she's blood related, which hopefully that's not the case, it's not going to affect your health history. When we talk about social history, this includes lifestyle patterns that could affect the patient's health status. So things like smoking, drinking, recreational drugs, or even if they're vaping. We look at their occupation, their marital status, their sexual preferences, diet, exercise, and sleep habits. All of these can have an effect on the patient. Thankfully, most of those are things that we ask once a year, so we don't have to ask them at every visit, but things like drinking and smoking might be something that we do ask at every visit. And finally, we have the review of systems. Now, this is generally performed by the physician themselves. However, the physician needs to know what they're looking at, and the only way that they can do that is by you taking the other 5 pieces correctly. So the physician will use different methods to inspect the patient, and those 6 methods are called inspection, palpation, percussion, osculation, mensuration, and manipulation. Now, each of those you guys can learn a little bit more about in your lecture course, but also in your Mind Tap books as you're kind of going through things this week. So hopefully you know what those 6 are and you are prepared to fully understand them. After you interview the patient, the provider will come in and see them, and then depending on what the provider has decided to do, they may ask you to come back in and help position and drape the patient. It's really important that we keep the patient's dignity and pride in mind when they are being seen for a physical examination. Draping the patient is really done by using sheets or blankets or even their patient gown to keep the patient warm and also cover all body parts except that are being examined. So we don't want to just leave the patient sort of laying there completely nude. We want to make sure we do keep them covered and keep that dignity that they have. Positioning the patient helps the physician with the examination, and there are 11 positions that you might be responsible for. So the 11 are supine, dorsal recumbent, lithotomy, Fowler's, semi-Fowler's, prone, Sims, knee chest, Trendelenburg, proctologic, and sitting. Again, you can read through each one of these in your examination, in your lecture course, as well as your MindTap book. So now we talk about what does it mean to assist the physician. Well, this typically happens during a physical exam. You will help the physician by, again, positioning and draping that patient. If they're elderly or disabled, know that you may have to help actually undress them and keep them in that position during that examination. You're responsible for handing off instruments and other medical equipment to help the physician. If you're handing any equipment to the to the provider, especially that have instruments, make sure you do it handle first. You will properly document and label all specimens. Offer reassurance to the patient and comfort them. Act as their advocate. But you also act as a witness to the behavior that happens between the physician and the patient. Specifically, if you have, again, a male patient and a male provider and a female patient. You're that second set of hands, second set of eyes to make sure no funny business happens. You also help to carry out any treatment plans that are done by the provider. That could be providing education, applying dressings, administering immunizations, or explaining medications, scheduling any diagnostic testing that the provider orders, and again, second set of hands and eyes during that exam. So now we're going to switch roles and talk about health maintenance. So I'm sure the first question that you have is, what exactly is health maintenance? So this is a part of the medical record that is a way for us to remind patients of any upcoming procedures, immunizations, lab work that they may need for medications or treatment plans. It helps us to know if the patient needs medications prior to their visit. It's just a really helpful way for us to be able to help the patient have a more successful visit, as well as the provider. Your job as a medical assistant is to make sure those preventative care items are met. So for example, we get a flu shot every year. So if you see that, a patient hasn't had a flu shot for this upcoming year, you would want to make sure that we talk to them about it, or even, put it as a note for the provider. Lastly, as the medical assistant, we need to not only do what is best for our patients, but help our providers as much as possible. We can do this by setting up refill requests for the provider before the patient is seen. So that way when they come in, they see what needs to be ordered. You've penned it up. All they have to do is review it and sign it. So what is important to remember is while the medical assistant can't order the medication, we can do that refill. And we talked about that last week when we talked about medication administration. And so the other thing is making sure that if the patient is on this medication long term, that you are setting that up for a year's worth of refills, otherwise making sure it's that 30 days. The last part for this week that we're going to talk about is ICD coding. So ICD coding is where we do diagnostic codings for different diseases, and CPT codes are used for different procedures. So this week in the lab, we'll actually have ICD-10 books there for you guys to work in groups on, but I'm also going to bring in an expert to talk to you guys about ICD coding. And she's actually going to help you through a little worksheet so you guys get to know how to use those code books. So that is all I have for you guys. Hopefully you are ready and excited for the week, and I will see you in class on Thursday. Have a wonderful week, everybody. Bye-bye.